Welcome back again. Settle in, grab you a cup of coffee, a bottle of water, your favorite soda. Maybe have a little bowl of grapes or some Skittles handy. Remember that at any point you can pause, rewind, re-listen. And I am so glad you're here. Hi again. All right. We reviewed negative feedback in our last video. Introduced the concept of positive feedback really for the first formal time. You'd probably thought about it, heard about it before, seen it in lab. Now we're going to talk about endocrine pathologies, which I think is one of the most interesting ways to solidify our understanding of the endocrine system. So to remind you a little bit, I don't have a color I like to do this with. There's this one. Okay, so remember that when we're thinking about the endocrine system, that our focus, if this is a head of a human, all right, my system here wants to help me out. They're like, that's kind of a sad head. Let's see. That's not what I wanted, though. Go away. I didn't want you. All right, let's try this again and see if it'll actually let me draw a head. Draw a head, maybe if I'm a little bit faster about it. Okay, so here's our head. That looks a little, yeah, anyway, don't judge me. And then inside the head, of course, is the brain, right? And then the brain stem, which comes down here, which we will talk about in detail. We tend to think about the brain in terms of all of this squiggly stuff that happens up here. For the purposes of the endocrine system, we're focusing just on one little spot, and you have actual images of this in previous lectures. You don't have to just depend on my really terrible drawing. Just this little tiny spot, right? Boop. If we zoom in, here we have, we have this little sort of place called the what? This place is the control center for the endocrine system, and it is the link between the endocrine system, between the body and the brain for the endocrine system, is this little spot. So what is this little spot? This is really important. What is this place called? Just beneath that little place, we have this sort of little dangly thing here. What is that called? It sort of just like dangles down actually into the skull. It hangs out inside, it's encased in bone. So all around here, that's bone. Okay, so these two structures are called the hypothalamus and the pituitary. And remember from our earlier lectures, the pituitary is actually two fused glands, and only one of them is a true endocrine gland. The pituitary, the anterior pituitary, remember anterior from lab, anterior is this direction in my super awesome face drawing, right? Anterior is the front of the body, whereas posterior would be the back of the body. So we have two fused glands that make up the pituitary gland, and the anterior pituitary is the one that is a true endocrine gland. The posterior pituitary is actually nervous tissue. Okay, so the pathologies, the things that can go wrong when we're talking about the endocrine system, there should be an I there, endocrine pathologies. I hope that you guys can read my messy writing, or at least since I'm saying it at the same time, that helps. Endocrine pathologies. Okay. What are things that can go wrong? These are pretty straightforward. You can have hypo secretion. So when we're talking about hypo in the body, this is hopefully familiar from osmosis and diffusion, or just from things that you hear, you're familiar with already. Hypo secretion is too little hormone. Or not enough hormone. What I think about when I hear hyposecretion, the way I link it in my mind is hypoglycemia. A lot of people, when we're going through puberty, or that phase where we're experiencing puberty and at the same time experiencing really rapid growth, we'll go through a period of hypoglycemia where our blood sugar is too low very often. And the combination of the hormones of puberty and the super rapid growth will lead to hypoglycemia, and sometimes you'll feel faint or pass out because you don't have enough blood sugar or sugar in your blood. You don't have enough circulating fuel in your blood. That's hypoglycemia. Some people, this persists into adulthood. I have it as an adult. Okay, hyposecretion, then hypersecretion. Hypersecretion is just the opposite, too much hormone. So I hope that's just like, okay, well, we can have too little hormone or we can have too much hormone. And then the last category is, remember, with all of this chemical messenger stuff, the key is the target tissue, right? The target tissue has to have the correct receptors. When we're talking about the endocrine system, hormones get released into the blood. Where does the blood go? The blood goes everywhere, right? So we have to have certain tissues that have the receptors for those hormones. Only certain tissues have the receptors. And so what we can have is that our target tissue doesn't respond how it should respond. And so if our target tissue isn't responding how it's supposed to respond, then we're not going to get the result that we want, right? When we talked about how these hormones come, they bind their receptor, and either there's going to be a second messenger cascade, or the production or the triggering of transcription, translation, and the production of a protein. If the target tissue doesn't respond as we expect, then we're not going to get that second messenger cascade or the production of that protein. Okay, so those are the broad categories. And when we're talking about abnormal target tissue response, so we have those two possibilities. Well, we had not just two possibilities, but the two that let's see, we can have the absence of transcription, translation, and stop and think for a second. which hormones produce transcription translation. So there's one big broad category, and then there's like kind of half a category that does this. So the absence of transcription and translation, or we can have the second messenger system. Like it's not triggered, or it's triggered ineffectively. I'm not sure if ineffectively is a word. What usually an abnormal target tissue response, words, is this one. So usually something doesn't work with that second messenger system. Okay, so a couple of examples, and we'll talk about others of these when we get into the specific systems, because remember, we're focusing on an introduction to the endocrine system right now, but the endocrine system controls, touches, affects absolutely everything. So while we're going to move on from talking about quote unquote the endocrine system, we will continue talking about the endocrine system for the entire semester. Keep talking about endocrine system for the rest of your life if you're in anything to do with anatomy, physiology, the human body. Okay, so first example is a condition called acromegaly. Acromegaly. And this actually literally means, translates as extremity enlargement. What happens with someone who has acromegaly is that in adulthood, the growth of bone and cartilage is renewed. So we grow and we grow and we grow, and around somewhere between 16 and 21 we stop growing. In an individual who has acromegaly, as an adult, that the bone and the tissue that's supposed to stop growing starts growing again. Yes? Just a second, I have a visitor. It's my little man. Okay. Little guy popped in. He wants to say hi. Hi. Okay. So, as I was saying, someone who has acromegaly, what happens is that the normal process of growth, because our bones and our tissues have to grow as we are growing, right? That's what causes our growth. That's renewed or restarted in adulthood. So this image is showing a woman who has acromegaly. And what you can see, kind of places to focus, easy places to see this are her chin and her nose. And as she ages, this is during adulthood, what we see is that her cheekbones are becoming larger and her chin is becoming larger, her nose is becoming larger. And then as she ages, we continue to see that growth. This image is also showing her hands, but we couldn't see that in the earlier pictures. What causes this, what causes acromegaly, is excess growth hormone. So the body is producing too much growth hormone, and it's doing this in adulthood. This is really important. This happens in adulthood. Acromegaly happens in adulthood. In excess growth hormone prior to adulthood is a different thing. So acromegaly happens in adulthood. Excess growth hormone. So if it's too much growth hormone, or getting too much of a hormone, what category is that? category of our three that we talked about. Talked about hypo, hyper, and then abnormal target tissue. So are we getting hyposecretion, hypersecretion, or abnormal target tissue response? In this case, of course, we're getting hypersecretion. So hypersecretion of a hormone. And growth hormone is secreted, you may remember from our earlier lessons, discussions. So here is in the brain our hypothalamus. That's not a great drawing of it. And it leads to, that's kind of terrible, wow. Try that again. That leads to the pituitary, right? So growth hormone is secreted by the anterior pituitary. Here. So what we're getting is too much growth hormone at the level of the anterior pituitary. What could be causing this could be happening at the level of the hypothalamus or at the level of the pituitary, right? If the hypothalamus is signaling the pituitary too much to secrete growth hormone, then that would cause hypersecretion of growth hormone. If there's something wrong at the level of the actual anterior pituitary, then the anterior pituitary would secrete too much growth hormone, because remember, it produces its own growth hormone. What usually is happening in the case of acromegaly is that there's a tumor. There's usually a tumor, and usually a pituitary tumor. Okay, so that's acromegaly. The juvenile form of this is simply called gigantism. And this is essentially the same thing. This is too much growth hormone. But this is too much growth hormone prior to puberty. Big, important difference. What happens with someone who has too much growth hormone prior to puberty is, rather than seeing that sort of abnormal growth, like we see disproportionate things, like with acromegaly, we see that this person had finished growing, and then because of the renewed growth hormone, we see the face shape change and look abnormal. With gigantism, that doesn't happen. What you get is you just get a really big person. So they have long limbs, long torso, they're just big. So this would be a person with gigantism as compared to like someone without gigantism. So their entire body just keeps growing. And again, this is also usually a pituitary tumor. Okay. So what's happening, the reason that we get different results is because in your bones, as you're growing, you've probably heard of this before, and you may even know the details of what's going on. But in your long bones, so like your arm bones, your leg bones, the parts of your bones that cause sort of height growth, you have this section toward the end, right here, that you'll often hear referred to as your growth plate. It's the epiphyseal plate. It's pronounced, different people pronounce it different ways. And what happens is before puberty, these cells that are here are called proliferating chondrocytes. What the heck does that even mean? Proliferating, it means that they're making more of, they're growing. And so what these chondrocytes are doing is they're really, really mitotically active, and they're making more and more and more and more and more of themselves. And as they do that, let's say that this bottom layer makes a new layer. What that's going to do is that's going to push these upper layers up and away, and that's going to make this plate bigger. Same thing, we make more, going to push up and away more, make this plate bigger, and what that does is that causes the bones to get longer. And so you'll hear people talk about, I broke my bone along my growth plate. And so sometimes if someone breaks a bone along a growth plate, that limb will be shorter, and that's because it causes damage to these chondrocytes and that they can't continue to proliferate. So that's why it's different between the pre-puberty pituitary tumor and the post-puberty pituitary tumor. That's hard to say. In adulthood, your bones are still being remodeled. Of course, remember we just talked about that we can pull calcium out of those bones. So there's a normal remodeling process that's happening in your bones. Oops, I should probably not make your bone blue. That might be confusing. Let's make your bone white. Okay. In adulthood, let's take your long bones again. Your bones are being remodeled for multiple processes. Sometimes your body just needs more calcium. Sometimes your bones need to be remodeled to support muscles. And so that's the example that I'm going to use. If we look at the humerus, you have this great big, gorgeous, one of my very favorite muscles. Is it weird that I have favorite muscles? This muscle that comes over the top of your shoulder called the deltoid. The deltoid attaches onto your humerus. And so the humerus has this sort of ridge of bone here where the deltoid attaches. And the more muscular the deltoid becomes, the more work the deltoid has to do, the more pronounced this ridge will become. Because the body is going through the process of remodeling that to produce a more pronounced ridge to support more musculature. So this remodeling process in the bone is still active in adulthood. And so that's why we get the body laying down more bone when there's excess growth hormone in adulthood. So there's a natural remodeling process. And that sort of goes awry. Is that how you spell awry? In acromegaly. Okay, how are we doing? 24 minutes. All right, stop in there, and then we will talk about a couple of other pathologies.